This video will take a look at the mid-sagittal section of the human female reproductive system. The first part is to look at some adipose tissue there with the yellow, and then the sacrum containing the red marrow there in the cancellous tissue. And this would be the fifth lumbar vertebrae, or the L5. Everything on this mid-sagittal section is considered normal. These in the blue are intervertebral discs going up and down the vertebral column there. A close-up view. The beginning of the external genitalia. This is the clitoris, number 6 there, or what I've just circled in yellow. Then the labium majus, or labium singular, or labium majora plural. And then the smaller of the two, labium minus or labia minora. Those two are part of the external female genitalia. Now inside this vagina, and the uterus here, non-pregnant, but the uterus. Then to take a look at the details in the uterus. This area I've encircled is the constriction or the neck of the uterus, also called the cervix of the uterus, at the tip there. There are two openings. This is the external os of the opening where the pointer is touching that opening, and then as we go inside, this is the internal os, that little hole right there. Now to take a look at the layers in the uterus. The innermost is the endometrium there in the kind of a pinkish and a red that I'm touching. The innermost lining. Next would be the myometrium of the uterus. This is the muscle tissue, or the muscle of the uterus. And next in the white line there would be the perimetrium that will become part of the broad ligament eventually. Digestive system here, the rectum, that is the last 6 inches of the digestive system. The anus is the hole or the exit point from the rectum. The musculature around the anus, this is the internal anal sphincter, that's a visceral muscle. And then the larger there is the external anal sphincter, that is muscle. The urinary bladder here cut open on mid-sagittal collapse, that is representing no urine in the bladder. The ureter is the exit there, down to the labia minora. The blue here is the pubic symphysis of fibrocartilage between the two pubic bones. Now for an angular, detailed close-up view of some of these. Here's the vagina again. And of course there would be the uterus shown in a different perspective. And then there's that white perimetrium again that will become part of the broad ligament. To look at that broad ligament, this white sheet here, there's the fold of it I'm touching right there. It's one of the 3 ligaments that's going to keep the uterus in place during pregnancy and during non-pregnancy. The second ligament here would be the round ligament going from the fundus of the uterus to the anterior abdominal cavity. The third ligament is the ovarian ligament. Goes from the fundus of the uterus there to the ovary. That'll be in yellow right there, the ovary. And then contacting the ovary but not attached are the fimbriae at the infundibulum, right there where the ova are released from the ovary into the fimbriae. And then from there the ova travels down the fallopian tube, which is also referred to as a uterine tube or an oviduct, depending on the textbook, but that's a light pink there. Blood vessels, this is the external iliac artery with the blood that would be going down in the direction of the arrow. Then adjacent to it, and in blue there would be external iliac vein with the arrow indicating blood going upward and leaving the abdominal cavity.